All right. Good evening, everyone. I'm just looking at my screen here and just making sure everybody is in place as we go live here. So, with that said, today is Friday, October 30th, 2020. Isn't that amazing? We are at the end of the 10th month of the year 2020. Wow. And so let me tell you, this has been quite a year. Some people want to say they want to cancel the year 2020. This is not the year. Thank you. Thank you. Thank you. Thank you, Dr. Gordon Atrebe. I love saying that name. This is not the year to cancel. I know there's the cancel culture that is out there. Imagine this. You have survived 10 months of the year 2020. And it's so good to see you all again on a Friday early evening and bring it to you once again our live session that is sponsored by Hope Health Systems, Chief Medical Director of Hope Health Systems. And so glad to see so many of you all who are joining in with us today. Please send in your comments. Please send in your questions. Just send in your hellos and thank you. Hope Health System located in Baltimore, Maryland. And so we want to let you all know that we'll do you some good if you come on over and let us take care of you. Kim, Dr. Gordon Atrebe, first of all, how are you doing? Let's just get started there.
So, I'm in a good place. I've been, doing a lot of radical acceptance. We're heading towards hopefully finding out who, our next president will be. And I know a lot of people have been anxious about that, including myself. And so I'm in a good place of radical acceptance, being in the now, in the moment.
Radical acceptance.
Radical acceptance.
Now, why is it radical? I mean, that's the thing I was scared of. Like, how is it that this has to be radical? I mean, we need to learn that if you lose, you lose. If you win, you win. What's radical about that?
Well, I think it's radical because oftentimes things happen that is hard to accept, right? And so, radical acceptance doesn't mean that you agree. Doesn't mean that you're okay with. It just means that you recognize that this is the position that you're in and you can deal with it. So that's where I'm at.
All right. Well said, Dr. Gordon. That's where I'm at. And, it is so true because election stress disorder is a real diagnosis. We're not fighting the DSM-5, but let me tell you, it is real. It is real. It is real. And yes, this is the last weekend before the actual general election for the United States of America. And so, yes, I'm looking forward to next week to another show. We will be right here. We will not allow any unrest. We will be right here. We'll be consistent. We're going to deal and tackle with the issues at hand. Absolutely. But I need you all to join in today. I need you all to go and grab someone who you love, who is a senior. That's what I need for you to do today. I need you to go grab someone, share this program. I'm even thankful for all those of you all who will go back and watch the replay of this. Go back, get someone who you are concerned about over the age of 60, over the age of 65. I know I have some people out there who are going to get upset with me. Why you have to call out a certain age? Well, we want to do that because once you get to a certain age, there's just certain things that you need to be made aware of. It's not a shot. It's not a downer. It's not a whatever you want to say, a shot against somebody, disrespect. But we want to make sure that our persons who have lived that long continue to live prosperous lives. And so I am so excited about the subject that we're going to deal with today. We have a special guest with us, one who I've heard a lot about. And but Dr. Gordon, before we even go there, Anything else that you want to say about this particular topic or anything else going on with you?
Of course, I have always a lot to say, Dr. Shepard. So thanks for giving me the mic. No, I just think, once again, I'm very excited to be a part of this. Obviously, we've had a number of discussions, but this one is actually really dear to my heart because, as we know, in our communities, our elders, our seniors are so vital to the historical narrative, and so vital to us understanding a lot about, where we're going and where we've been. And so, in Dr. Shepard's wisdom, we wanted to really address, Black men in this month. I think we've done a number of conversations about Black men. So I'm excited to have both Dr. Shepard and our special guest, Dr. Stephen Starks, as Black men who I know represents the culture and also represents, psychiatry, and really have an understanding from the, developmental milestones that we all have to achieve, obviously our goals in life. So, the topic today is a healthy paranoia effect. We're going to talk about how Black seniors are doing with the COVID pandemic and beyond. So we wanted to have a conversation with someone who's an expert and discussing issues related to geriatric psychiatry and seniors. And so, of course, I had to invite Dr. Stephen Starks. And Dr. Stephen Starks is a dear friend and colleague, but he's one of those people who is just everywhere. So I can't describe him in one nutshell. So I'll say this, Dr. Stephen Starks, he has some roots in Louisiana. And I want to give a shout out to those people who've been affected by Hurricane Zeta. I'm from New Orleans, so I know very well that as we discuss these topics, climate change is one of those issues that is one of the stressors that people are facing today. But Dr. Starks, he went to medical school at LSU, Louisiana State University, and got his medical degree. And from there, went to Baylor College of Medicine in Houston, Texas for his residency. And this brother just kept moving. He ended up doing a geriatric psychiatry fellowship at Yale, New Haven Medical Center. And from there, he just kept going and went a little bit further and was a congressional fellow for health and aging, a fellowship program to address issues as it relates to healthcare, and really has been vital in our community for shaping the landscape of minority mental health as well. He has a unique understanding of the cultural and social effects of mental health conditions on patients and their families, and has been an integral part in his role at Baylor for helping medical students in their medical student education and understanding the health disparities that we face today and how to integrate mental health inside of home-based care and long-term care and primary care. So I'm just really excited. And as we know, elderly seniors are really integrated into health, into the primary care system. And many of our geriatric patients may not have been exposed to mental health. And so I'm just interested in Dr. Shepard's and Dr. Stark's comments today, but especially just the opportunity to talk about this important issue. So thank you, guys.
Wonderful. Let's bring on Stephen Starks. How you doing, sir?
Pretty good. Pleasure to be with you both, Dr. Shepard and Dr. Gordon Achebe tonight. Always great interacting with my psychiatry colleagues. I know we are very physically distant right now, being in two different states and two different regions, but glad to see you both and glad to be a part of this conversation tonight.
Great, man. Thank you for being here with us. Dr. Stephen Stark's reputation, as I was telling him before we got started, precedes him. Some of my good friends, they rave about him. And I just want to even give a shout out to Dr. Erica Draza, who is a faithful monthly contributor to this show. She's watching. I hope she made it home from Puerto Rico last week. She was in Puerto Rico and did the show from there. So I'm hoping, just put in the chat if you made it home safely. But it is so good to see you, Stephen. So we're going to go ahead and get started. And really, I'm just going to start off with just kind of a general question, and then Dr. Gordon will take it over from there. All right. Yeah. Erica says she made it safely. Wonderful. So just tell me, what have you been experiencing in your practice with working with seniors Well, you know what? And even in that, I want you to personally, I never want to just, say, as far as that people are just their work. I mean, what have you been experiencing personally? And then tell us, how has that influenced your work, especially as you've been working with seniors during the pandemic?
Yeah, so that's a great question, and I think for many of us, right, we do have that intersection of profession and personal life. There is oftentimes that overlap. And being that I'm a geriatric psychiatrist, so a psychiatrist who cares for older adults tend to have different conditions in late life. They may be made more vulnerable because of memory problems like dementia and other conditions. So the subspecialty of psychiatry is pretty unique. Obviously, I have family members who also are older adults and older Black men and women in our community. So I've been quite worried and quite concerned about our community in the midst of this pandemic. So as we all know, we've heard it on the news, we can see it on and read it in newspapers, we see it on social media about the disproportionate impact of COVID-19 on our community, so on the Black community. And as we know, older adults are more vulnerable than others. So this is something that has been near and dear and close to my heart, because I'm well aware of what our seniors face, whether they live in communities, in their own residences, in their own homes and apartments. I'm mindful of those that are in long-term care centers, where we know that they are at increased risk because of their living environment. So those in nursing homes, nursing facilities, personal care homes, or assisted living facilities. And so I'm very kind of well attuned to the different challenges that our community face. And as Dr. Gordon Achebe mentioned at the start, I do have roots in Louisiana, as we know that New Orleans was one of the early epicenters at the start of the pandemic. And so very concerned for family and friends there in that community. And always kind of trying to quickly kind of respond and heed to those family members. And like I'm sure many of us in our profession know someone who knows someone or has a direct connection to either COVID illness or COVID death. And I have had that experience for myself with having different family members kind of contact me for advice or insight, or to kind of share the unfortunate bad news of losing a parent or another loved one in the midst of this pandemic. In addition to that, right, we have our professions, right, and we're all quite active in our professions, right, in our communities, or in what we would term organized medicine, so medical organizations that are tied to psychiatric needs. And so we've all been kind of working hard to spread the message and spread awareness about the impact that's happening in our communities. Because as we all know, it's not just the physical illness and disease that people are kind of concerned about. We're also concerned about that traumatic response that people are having. So that those increases in anxiety, depression, post-traumatic stress disorder, grief disorders, prolonged grief disorders, and other kind of manifestations that we're seeing now, and that will only kind of likely kind of grow in the next few months as people try to cope and recover from everything that has been the COVID-19 pandemic.
Yeah.
Well, I mean, you said it so succinctly, Dr. Starks. And Dr. Starks and I have worked in organized medicine for many years. I remember when we met in 2010, it was interesting because we were both in New Orleans, but I don't think we had met in New Orleans. I went to Tulane, he went to LSU. Maybe we crossed paths, but it was actually in 2010 that we worked really closely together with the Assembly for the American Psychiatric Association. And it was the first time, that I think either one of us had an opportunity to really look at what's happening on a national level as it relates to mental health and how you can become an advocate, from action papers to, going, to Congress and having these conversations. So these things have implications, but I really think about, what I understand about the recovery model and what we're calling recovery today. I think a lot of people are worried that they're not going to be able to bounce back, particularly older people.
Yes,
are going to be able to bounce back from this pandemic, and also the stress that we've seen played out with George Floyd and the protesting, the Black Lives Matter. Many of our elders have experienced discrimination and civil rights movement and now have some questions about, what's the future going to be like for the next generation, for their grandchildren and great grandchildren. So, I mean, this pandemic has really shook things up in some of the older patients that I've spoken to and interact with. So, I'm wondering, Dr. Starks, if you can kind of tell us what you feel has been issues, even pre to the pandemic, the COVID pandemic, for African Americans as it relates to mental health, particularly our elderly patients, and how that may impact their trust or impact their health with this pandemic.
Yeah, and sure. So I just kind of written an article, I guess that was end of May, kind of about this topic for our association to kind of draw attention to, what our seniors were facing at the time. So we know, because we're insiders, right, about the racial kind of health disparities that exist for our patients in our communities. We know them quite well, right, because we're very kind of cultured and kind of connected to what's happening, and we're all kind of striving to advocate for it. So this was already kind of just, and unfortunate, I don't even want to use the term a perfect setup, but we were already kind of primed to know that a pandemic of this kind of magnitude would already, really kind of, in essence, kind of decimate our communities. We were already kind of made vulnerable by structural racism that's been set up in terms of access to healthcare delivery. So that can be insurance access, right, or access to physicians, healthcare in your local community. And that even if you have it, so older adults, as we all know, at least those 65 and above, have access to Medicare. But we do know that even when older adults, when seniors have access to Medicare or their Medicare Advantage plan, that their care and treatment is different from white patients and counterparts. And we often know that not just different, but also not often at the same kind of high quality level that's getting. And that's for a number of different reasons. We know that a lot of that is probably due to kind of racial discrimination or kind of either patients feeling dismissed, diminished, their cries for pain or their kind of expressions of pain or illnesses may not be kind of interpreted by the experts, medical professionals as it should be. So we already know that is already kind of in place and in practice there. In the midst of the COVID pandemic, too, we now know, especially when it comes to either utilization of emergency room services or in terms of hospitalizations, that there's also a barrier for access, right? If that ambulance is afraid to come to your community because it's the quote unquote bad community, quote unquote in the hood, you may not have the same kind of access to the same type of care that's immediately kind of readily accessible to you than if you lived in a different zip code. So we oftentimes talk about what zip code you live in kind of determines kind of what type of care you might receive or might be an indicator of specific health outcomes, but not so much the zip code, but maybe the racial makeup of those who live in those specific zip codes. We have that kind of overlying it. And then we just have historically kind of American medicine has really never partnered with our community. So even now, sometimes when we talk about, the history and legacy of the American medical system on Black patients, we always like to think about the past, right? We just talk about maybe Henrietta Lacks, or we talk about, and their use of her cell line for all these amazing kind of biotechnologies that have resulted, countless biotechnologies that have resulted since. Or we talk a lot about the Tuskegee syphilis experiments again, right? And so those things stick in mind, but we don't often talk about the present day discrimination that continues to happen in the communities. Or we don't talk about, those regional or local breakdowns that have happened in hospitals or in terms of kind of supporting Black communities. And we don't talk about the continued legacies of, hospital systems, academic medical centers, not really partnering with the communities that they supposedly serve. And so, the past is always important, but I like to remind people that present day, things are still happening right now. that kind of caused this imbalance and this shift there. So as I was writing that article and going over that history again, some of which I knew and some of which I was learning kind of more of, it was an incredible kind of weight again, as I was reminded that this system perhaps wasn't built for us. And so what can we do as the few medical professionals, either in our respective careers, in nursing, in medicine, in social work, what can we do to make significant kind of impacts, and what can the larger systems and structures do to respond appropriately and adequately to our needs? And something you pointed to, Dr. Shepherd, and something you also pointed to, Dr. Gordon Achebe, is so in the middle of all of that, then we have kind of this resurgence of these social injustices and these extrajudicial killings of Black men in the community that kind of reinforce and this impact on our communities. And now on top of that, we're dealing with the next iteration and phase of civil rights movement with the Black Lives Matter movement kind of present day. And so again, these two pandemics or twin pandemics that have been discussed so much, of that of structural racism and that of the pandemic itself, has been kind of quite a weight and a challenge. And we've all just been trying to stay focused so that people don't miss the mark on that. So that's why I'm enjoying this conversation, because we haven't talked too much about the elderly, right? The conversation has shifted to responding to kind of police excess force and police brutality and violence. But I am glad we're having this conversation today about our seniors, because we don't want to forget about them and them to be lost in this discussion as we talk about this current millennial generation. We should also remember our baby boomers and our traditionalists out there who paved the way and set in place some of that foundation for those same kind of practices that we use in terms of protesting and activating in this movement today.
Yeah, I mean, I'm just thinking about the foundation, like the foundation. You made a comment about, the system was already fragile, and the system wasn't made for us per se. And then how do we begin to build a new system? I laugh when people say "Make America Great Again." I'm American. I do believe that America has great people, right? And great ideas, and our democracy have great ideas, but the system always was flawed, right? It was always flawed. And now, because the foundation is flawed, we have a tsunami of pandemics and crises. And oftentimes people, they argue that, particularly people of color, Black, Indigenous, and people of color, we just focus so much on the negative. We just focus so much on the crises that we're not, aware of how much we've overcome. I can tell you without a shadow of a doubt, with the elderly people that I've talked to, they are so aware of the strides that we've made. They built, the structure that you and I afford, right? I think about my mom who passed away of breast cancer in 2009. I mean, she would be a senior citizen if she was living today. But boy, the work that she did and her generation before her did is the reason why Stephen Starks and Dr. Shepherd or Gordon Achebe could have this platform to discuss these topics. So I don't think that this is a group of people who are not aware of how great America can be, but we're also aware of how bad America can be also, and particularly the generation that comes before us is even more aware. And seeing George Floyd, the way he passed away with the COVID, during the COVID pandemic, that probably was for some elders just enough to set them over, to increase their immune system and, making them more distrustful of healthcare and more distrustful of, any type of governmental assistance and that sort of thing. I shared with you guys an article that CNN published about elderly being ill, being elderly, and being Black in the pandemic. And they talked about the number of seniors who passed away between the ages of 60 and above. And 80% of the people who've been affected by the COVID pandemic has been seniors. 80%. Now that 80%, three times of those people are African American, right? So we are 3 times at risk of dying. These are deaths. These are mortalities here. So I'm wondering what the implications, and Dr. Shepherd, you can answer this too. What is the implications for our communities when our elders are no longer living? You know, as a child psychiatrist, I know the implications because many of the elders are raising their grandkids or an integral part of, you know, the financial structure for their family. So these implications are really, really, I think that we're not going to know how much this is going to affect us until much later when we all have some time to breathe. And I don't know when that's going to be. No doomsday, because I'm still hopeful, but I just wonder, what do you guys think? What is the implications for the next generation, and even the millennials not having these seniors here to provide that wisdom for them?
Yeah. Go. I'm gonna let our guest go first.
Yeah.
So I think obviously a lot about that. So one, I think about kind of how interconnected our communities are in general, and you talked about that kind of intergenerational kind of phenomena, either kind of residing together in the same household or community. I often think a lot about the role of seniors just globally in our community, right? The wisdom that they possess, their role and kind of stance and status within our family systems and structures, and their role just in terms of kind of broader kind of kin networks for us, right? Like there's, we know there's a big mama you can go to, or Medea, or, you know, your grandfather who's wise, or that older uncle or great uncle in your family that is kind of a, you know, in a place of reverence. And so you kind of lose out on kind of that personal history, that family history, that wisdom and that connectedness that our older adults kind of possess for us. And so I think it is for those who have kind of lost loved ones to it, right? Especially in this manner, because many of these deaths are quite unexpected and abrupt, right? A short time frame, so are more likely to kind of lead to a more kind of traumatic response for those individuals who lost their loved ones too. I also think it also reinforces that message in our communities, right? That the health system, no one's out to protect us or to take care of us in any manner. They don't care about us. So that's kind of on the negative end of it. I do often try to look at kind of our community interconnectedness and resilience as well, because I don't want it to be all negative, right? So what lessons, how will we grow and kind of evolve from this impact? It won't all be negative. I do think it's kind of brought together a greater sense of kind of connection and solidarity. And I also think it has brought in a sense to kind of look out for one another in the community. And so I hope those individuals who do have access to their seniors are doing something to connect with them in some way. And there are different ways that you can still kind of connect with someone physically distant, but that still shows that you're there to kind of support them, maybe in the midst of the isolation that they're dealing with right now.
Yeah, you know, I just want to speak, and I'm going to try to be as short as possible. But I just want to speak to that senior who is listening to us. I want to speak to that person who is above the age of 65 or older. One of the things that really struck me as I prepared for this live session through the article that Dr. Gordon Achape referenced is that they are alone. There are many who, as the article referenced, don't have any children. They never got married. And so if they don't have any children, not married, many of them don't have that outlet because a lot of the day centers where the seniors were going are closed. You can't gather in any type of setting right now. Well, you shouldn't. Let me just say that because somebody is still pulling together gatherings. All right. Anyway, so there should not be any large gatherings. There still should not be any medium-sized gatherings. And so many of the seniors, they look forward to going to those activities. They look forward to going to the house of worship. You know, that was their way of escape. And when the church doors closed, many of them, they missed that connectiveness. And, you know, I was just even thinking, one of my dear friends, he was commenting about how one of the seniors who was impactful in his life died recently. And he was just sharing how he would care for her and how that made her feel and how that made her feel special. You have not pulled that away from them. And so what I want to let that senior know is today we are taking time to let you know you are special. All right. We do care for you. There are physicians right here. The fact that you are listening to this, the fact that we are here talking about it should let you know that someone does care about you. And that's really what is my main point for getting out of this show today is how do we make sure that we let as many people as we know who fit that category. Yes, many of them have died, but there's still those who are alive. Let them know that we care for them. Because Kim, you asked what the implications are. The implications are huge. That means that the legacy, that means the stories, that means that the witnesses that made it through, helped us overcome, are no longer there. So if you don't hear those stories recited in your ears, and when it comes up, when you face your battle, you don't know how to overcome.
Right.
The circumstances change. Man, I said I wasn't going to talk that long, but got me stirred up a little bit here. And so, I will quit right there. So that's what the implications are. I guess should be speaking more than me, but yeah.
No. That was important to say. So I'm glad you did chime in about that. And we really do have to kind of be creative about ways to that we reconnect, right? So whether that's writing letters, sending cards, picking up the telephone, right, to kind of share that experience. Those seniors who are kind of connected to their, devices and have data plans to either, kind of maybe think outside of the box and have their group chats, right? I've heard people kind of talk and discuss about the fact that they're in a group chat and they've been able to kind of continue their prayer meetings or their socializing or encouraging each other for physical activity or fitness through that kind of means if they have access to it. But I do think about the folks who have been, to your point, estranged from their families or disconnected from their families in some way. I think it is a harder to kind of build that sense of community. And so I hope that our faith-based organizations and churches or other community organizations are being creative about ways to connect with our seniors and even thinking about their other social needs. So we obviously think about their psychological needs, but right. I think about those who may be food insecure. So do we have food assistance programs out there to make sure that people have connected? If they're trying to connect with their healthcare services, right, are they still able to do that in the midst of this? Do they have access to telehealth that we're, all kind of working with right now? Are they still going in for face-to-face appointments? Are they getting their medications refilled? Or are they having any kind of problems with getting access to care and therefore kind of worsening in their health conditions? Are they gaining weight because of either stress or not being as more sedentary than usual? And so thinking again about kind of how do we kind of reform ourselves with this new normal that we're all living in right now.
Mm-hmm.
There's a question, Kim, if you don't mind me asking, and again, just chime in from one of our viewers. They want us to discuss our views about the proposed COVID vaccines.
Yes.
And really, that is in particularly a vital conversation to have with our elderly. And so, I'll just leave it alone at that. I mean, they added some other stuff in there, but I think that's just really the essence of what they're asking. So, what is your view?
I'll start, Dr. Starks, just because I feel, kind of passionate about this, just from the spectrum of even children getting vaccines. We've already seen the pediatric populations to decrease their vaccines this year because parents are scared to bring their kids to the doctor, right? And that's, a real fear. And obviously we have to do our job to recruit and help educate, schools and parents on how to get their kids safely, to their doctor's appointments to get those vaccines. But that same thing is true for elders, but in a different field, particularly African Americans, who feel that this vaccine is experimental. What's going to happen? Are they going to use me as a guinea pigs for everybody else? They already don't care that we're dying at high numbers and the government is, So I've heard those conversations. I even talked to an 80-year-old man who's a patient who shared with me that he doesn't think he will get the vaccine if it comes. He thinks that he's old enough at this point. He'll just take his chances, right? But I think, in thinking about how healthcare works, I mean, we can imagine all the different structures that are in place to try to figure out this out. But, when someone has Medicare or Medicaid, oftentimes they are the people who you can quickly recruit for treatment and make mandates, right? There are policies that mandate certain things for people to have their health insurance. There are doctors that still practice today that tell patients, well, if you don't do it my way, then don't go get another doctor. And oftentimes it's hard to find another doctor in your community. So I think we do have to think about how can we have these conversations. And I think some of you guys probably saw the CNN report where they showed the first person that was tested for to be tested for a vaccine, and they had her there, and she was talking about she's happy to do this. And I remember looking at it and being very angry. I was like, why would they pick a Black person to be the first person to experiment on national TV about a vaccine? Do they not understand the historical context of that? And what that means for Black people? What's going to come to mind? Which is why I called this the health paranoia effect. I don't know if I have an answer here. I really feel like I trust medicine, I trust science, right? I think for the most part, most doctors trust science, right? But we have to work really hard for our communities to trust science. But that means that people like you and I have to represent for them what medicine is. Dr. Starks can speak to the COVID vaccines for our older people, whether or not we think that they'll be recruited to do these.
Yeah. And we talk about how important it is for that community, right? So the most vulnerable of the group, we think about the vaccines that seniors are encouraged to get kind of regularly already. So annual flu shots more important in that kind of age sector. We talk about the pneumococcal vaccines for for certain types of pneumonia, and we talk about the shingles vaccine as well, because again, high risk groups there. So we have another vaccine that's going through these kind of scientific studies, going through these clinical trials, and I think it's important for kind of public health officials, state and federal, to kind of increase awareness about those safety concerns. So it's a very realistic conversation. So one, can we get our Black kind of study participants to participate in these clinical trials, to be a quote unquote guinea pig? But we don't really look at that, right? They're research subjects. There is something that's called informed consent. And so when you do enroll in a research study, you are given information about the possible risks that occur with it. And so we do know that when studies are in their third phase, their third portion, that they're kind of tested on a large number of populations, large number of people, large number of subjects, to kind of figure out what are the expected risks or adverse events or side effects, as we call them. Either the minor ones that might kind of be mild, like a mild headache or a cough or something, or the more severe ones that can cause someone to need to seek some type of medical care. So I think it's up to the Food and Drug Administration, to again other kind of public health officials, to appropriately inform and engage our communities as a part of that process, right? I think a lot of people are of the mindset, I don't want to be the first one to get it, but maybe I'll be, down the line there. But we do know, and again, being at the other end of the age and developmental spectrum, how important vaccines are in terms of kind of reducing public risks. So not only for your own safety, but the safety of those around you. And again, I think a lot of people are eager to get back to, old life, take it back to 2019 in a sense. And so it will be interesting to see kind of how the rollout for the whatever vaccine is the first one there on the market, how that happens, and which communities have access to it first, or should have access to it first. So should we be targeting, Black communities who have been impacted? Should we be targeting the Navajo Nation? Should we be targeting Hispanic and Latinx communities, kind of given the disproportionate impact on those first? So yes, it'll be kind of one of those kind of watchful waiting to figure out kind of what happens there. But yes, when the scientific evidence and information is found, and we do have information on what what level of protection those vaccines confer. It's going to be easier for people to make their decision on what's best for them and in their life.
It would be interesting if there were some studies showing different communities, maybe even communities that have the same makeup, even if it's more predominantly Black in one community, more predominantly white, but more the economic makeup or household makeup, and really looking at who's been affected. I mean, one of the things that make people suspicious is there hasn't been a lot of transparency about who's being more affected about it, and also with the contact tracing that we hope for by people getting tested to protect communities. If we could think along the lines of, okay, let's make sure that the most vulnerable communities have adequate COVID testing. Let's make sure the most vulnerable communities have adequate health care and they are in a good place to have the vaccine. Let's make sure more communities who are less, I've been thinking about this, less vulnerable, maybe be the first phase of getting the vaccine, because that protects all of us, right? So the more people that we have the vaccine and are doing well, the more protection for all of us. I wonder if there are people who are a part of these boards who are having these conversations from a cultural perspective. Our essential workers obviously are the most vulnerable, right? But our essential workers are ultimately interacting with everybody, including seniors, right? And so, I think there has to be a thoughtful approach with that, and some of that requires us to unfortunately be on the same page. And I don't know if we as a society are on the same page right now. And I think that's the biggest stressor for all of us, that we seem so polarized in our thinking, where it seemed like in 2019, people, even though we had the same administration, people were less divided, and so I think the human in me wants to say, we have a lot of tsunamis that's happened that's making people feel less, more dependent, and the election coming up that's making people more divided. But not much has changed other than COVID, right? So why are we more divided than ever? That's just the question I keep asking myself. COVID is a big one, right?
Oh yeah. Well, let me tell you. I'm gonna sort of challenge what you're saying, Dr. Gordon. Some things have again changed, but I tell you, a lot of stuff that was present now was present before. I think what has happened is just the light has just been shown on it, and more people become vocal about it. I'm more vocal than I was last year. Yeah. I'll tell you right now, don't come to me with no junk about institutional structure. I'll get you together real quick. Now, 2019, I might have been a little bit more laid back, but I have no problem letting you know now. Don't come for me. But
we saw. We saw all of that before. So I kind of want to remind people that although this feels, my point, and I'm sorry to cut you off, Dr. Although this feels like the worst thing that's ever happened, most of the ideology of Americans has been there. I think I was looking at Oprah today, and she mentioned that one thing that's going to happen, but regardless of the verdict of who becomes the next president of the United States, is our country will see who we really are, good or bad. We will see who we really are. But who we really are is what we are right now. And how we treat the most vulnerable for us is who we are.
That's right.
And I guess that's what I mean. Nothing has really changed, but the angst that we feel is very different. And I'm more vocal than I think I was always vocal, but I think I'm even more vocal than I used to be.
Oh God!
And I would say that we're a group of vocal people now, but I think people who historically may have been silent are activating now and are kind of recognizing it. And so I think that's the big difference, right? Like I always say, this is we are in essence kind of reliving the same history. I know all of us are kind of students of history, especially when it comes to structural racism in medicine, and so we think a lot about it, and so these are not new conversations that are having. I think there is a larger kind of awakening in the midst of it, so people who weren't as aware, and I actually started to think of myself, were particularly the groups who has historically kind of been made vulnerable, marginalized, oppressed, were we kind of, in essence, silenced over the years, right? So it's people kind of shut us down when we try to kind of activate, and then we think it's kind of normal. And so is this new awareness, even though it seems like, wait, this has been going on. What are you talking about? Why are we having this conversation now? I told you that last year. You didn't hear me when I said it. So it's interesting to see, and there is that broader conversation about this new global awareness, right? Like it feels a little offensive at times, right? Because these are things we live with, right? This is our lived experience and the lived experience for our communities. And it's only when you see us, dying at disproportionate rates of COVID-19, or only when you kind of witness a video that's recorded of our injury or our death, that then we have to show you the worst of the pain. You have to see the worst of it to realize that something is actually happening under the surface. I am encouraged by the conversations now, and in this movement, this shift feels like it's something that'll be a little bit more sustained. But I think to your point, and maybe while we're all more vocal now, is that we had enough of it. Before we could tolerate the incremental changes, but I think now we're like, okay, let's shut the door on that, and let's just turn the switch and kind of create a more equitable atmosphere in healthcare, and then broader in our national landscape.
Let me say this. If we're going to see the change, we have to see people like you, Dr. Starks. We have to see people like you, Dr. Gordon Achabe, leading the way. We have to. It will not get done unless we have Black doctors who look like you all, who know what they're talking about, and know how to be able to convey the message to the community before we will see real change. And I am on that mantra. I'm on that train. I'm thankful for Dr. Jerome Adams, who's the Surgeon General, but they really have tied him down. You really don't even see him anymore, which is unfortunate. But if we're going to really see the vaccine take place and be utilized effectively, let me say it like that, within the Black community, it's going to take people that look like you, myself, and a whole other of our colleagues to really push this message that it is okay. And so that's why, I really am thankful, that we have people, like yourself, Dr. Starks, who are out there who really care about our Black seniors. I just wanted to make that point also. So if there's any other Black doctors out there, you're going to see this. You got to get ready, seriously. Put on your cape or whatever you got to put on to get yourself together, to get geared up. But we have to see, the Black community has to see our face to know that it's going to be okay. Mm-hmm. And I really am pushing that message over the last 2 months now, because it's not, I'm so thankful for all the other people, and I'm going to stop, but it's going to take us. It really is. All right, Dr. Gordon, what else? What else we got? We got another about 10 minutes here.
I'm full. I kind of wanted to ask some other things, but I think we hit a lot of that, just in talking about how to stay socially connected. I think we should probably end with actually really thinking and being creative about what ways can we help do the work to help, one, make sure that our seniors have adequate health care, but two, make sure that they're maintaining their mental health and staying socially connected to their communities. I know, my church is doing a lot of, virtual events, even like virtual workshops and virtual meetings. But many of our older people aren't accessing that because, one, they may not have an iPad or a computer at home, or they just don't know how to use it. They may maybe be able to afford it, but they just don't know how to use it. One of the things I was thinking about is recruiting some younger people to teach some of the older people how to use technology. And that may require an outdoor event, where you have a screen up and have the iPads and pass them out and say, hey, we're going to learn this today. But I do think that we're in that time where we have to be thinking in terms of civil rights that way, Kind of like how the Black Panther movement went around and gave people food for food insecurity and education in that sort of way. We have to educate people on how to manage the virtual world, right? One of the questions I had is the virtual world depressing, our seniors? Are they becoming depressed because they're looking at Facebook and they see everybody seems to be living their life and everybody looks happy because, we know how to take those nice pictures and show our plants and, whatever we show to make it look so, good. And they're like, well, I'm kind of stuck in this house and I don't know when the last time I had a really good meal with a friend, right? Wow. And so we have to be careful when we are posting things on social media to be mindful of who's reviewing it, right? Like I have some older family members who don't have kids, but they were instrumental in raising me, right? And so, but because of, my work and everything else, it's hard to connect. And I don't feel comfortable exposing them because I don't want them to get COVID. So I have to be creative. So maybe you guys have some thoughts about like social connectors. I know Dr. Shepherd mentioned his church in a previous talk and how many pastors or people who passed away from the pandemic. But what is churches doing for those people who are still connected?
Yeah, I think it's important for us to be kind of very cognizant of that. So we need to think about kind of opportunities to volunteer, to develop projects in our communities, so whether it's church or faith-based or others, right? Can we have kind of a buddy system of some sort? Can we adopt seniors or families, have them a part of our families, so that neighbor next door who, you historically didn't talk to because they kind of keep to themselves, how are they doing? You've never seen any family or friends or any cars in their driveway to visit them. Well, what's your role as a neighbor, a member of your community to kind of engage them in some way? Again, being creative with how we communicate. So to your point, being mindful about the difference in broadband access for certain communities. So specifically, communities in certain inner cities, rural communities where our seniors live, if they don't have access to Wi-Fi, and they may have a sketchy data plan, then they are kind of isolated in a sense, or have that kind of that technological void in a sense, or the other ways that we can kind of participate. Thinking about, where seniors currently kind of connect in the community. So what are senior centers doing, if they're open or closed? If they're open, is that an opportunity for you to kind of walk in and say, hey, I know you're probably not able to have your seniors congregate here, but is there any way I can kind of participate? Thinking broadly about, ways that seniors kind of connect with community services. So everybody should have a AAA or an area agency on aging that's associated with the town or community. So you can Google that. It's AAA or area agency on aging, and type in your county, and you may be able to find some information there about kind of additional supports and services. Think about who delivers food to communities. So those seniors who are on Meals on Wheels programs or other kind of food meal delivery programs, or who are getting congregate meals. Is that kind of a way for you to activate? Can you make meals for seniors in your community? You got some extra or leftover. Can you walk it around or deliver it? So I think we can be creative, and there have been a lot of kind of creative attempts, people forming apps and kind of ways to kind of engage with apps to kind of connect with one another, to kind of be mindful about what's going on in their community, and then doing some service. So, how are our seniors maintaining their landscape if they're having any? How are they kind of doing projects around their home if they're not able to kind of get out? So being very kind of mindful about what's happening in your area. I think sometimes people think too hard about it, right? I always say kind of stay local, stay close, look around you, and start there first and then build out. And then to your more expansive point, I'm a policy person, right? So how are we kind of engaging with our representatives at local level, local municipalities, state level, federal level? What are they doing for our seniors? So are we asking those hard questions in the midst of this election year when everybody is so engaged politically in the process? What are we doing to ask about our seniors who have been made vulnerable by COVID-19? So what is the legislation that's out there? What is the work that can be done? And if you're not, too familiar with a particular bill or the language, you can always just ask directly. this is what I see in my community that's happening to seniors. They don't have access to care. They don't have access to food. There's some financial instability in the midst of COVID pandemic. They're facing social isolation, asking those direct questions and expecting an answer. Of those people who are in those roles as our representatives is critical for us to do specifically at this time and at this juncture.
That's good. That's good. I just want to highlight something that, over in the comments section, one of the persons I know back from Chicago. So again, this show is being seen throughout the country. And Carolyn Jarrell Smith, who, my Lord, has probably known me since I was, I've dated myself, like they say, the country knee high to a duck. She's known me for a while. But listen to what she said, though. And this really goes back to the point, and it really emphasizes the need for a Dr. Starks, for a Dr. Gordon Achebe to continue to stay persistent in doing what you do. She says, as a COVID-19 survivor, didn't know she had COVID-19. She's afraid to get the vaccine. I understand that. And afraid to get the flu shot. Still afraid. I would only take it because I know and trust you. But it's going to take a whole lot of prayer. I got on late because she got onto this particular show, so she wasn't sure where we were as far as the topic. But let me just tell you, I take no pride in that statement. Let me tell you, because that actually puts more onus on me. That puts actually a weight on me to make sure that I am giving out the correct information or the appropriate information. Mm-hmm. It doesn't make me heavy or weighted down, but what it does, it makes sure that I am being responsible in what I'm sharing with the people. And that's why, again, this show is here. So many people, she just said, I've never had the flu shot. Do you know how many people never had the flu shot? And we even emphasizing it at Hope Health Systems, where we are right now, where Kim and I are at, because there's so many people who've never had it. And I'm letting the folks know this is the year that you cannot skip getting the flu shot. You can't skip it. I made sure my dad got it, and he had some muscle soreness afterwards. And so he called me. He was a little bit scared. He said, what is this? As I said, this is typical, my parents, they are in their 70s. And so, I'm concerned about them. And so make sure they got their flu shots. So I appreciate you, Carolyn. It's time to get the flu shot, everyone. Got to go get it. Even if we just helped you today, that is one person who we have prevented from sequelae from getting something worse. And so, man, that really helps me. And so that's why I go back to what I said again. We got to have folks who look like us out there. I know some of these organizations, we get sick and tired of them because they don't treat us right. I'll go there. They just, put me out there as some poster child. Okay, well, that's fine. You put me out there. I'm going to say the truth. I'm going to tell you what needs to be said. But I want people to know that we have got respectable people here. I'm going to stop right there. What party messages do you want to make sure Dr. Starks and Dr. Gordon Achebe that people leave here with today? Our seniors are so important to us. What would be your closing remarks to anyone who's out there?
I just like to remind people of kind of the resilience and wisdom of our seniors, and that they should be revered in our community. We, have different kind of levels and manifestations of ageism, and sometimes, think what's young and shiny is the most attractive. But I oftentimes think about, and something that maybe most people may not realize is that, the older you get, it's actually the less susceptible you are to certain mental health conditions like depression and anxiety, and you start to find kind of more joy and fulfillment in your life, right? Like, why is this? So what's happening there? And we do think a lot of that is wisdom and lived experiences. So just to remind people that our seniors have lived through a lot in America. at this point. And while some of them feel like they're reliving the past, feel like at times that they're back in the 1960s, there is the awareness on their side that there is an opportunity for things to get better. And I think we are kind of the fruits of their labor and their efforts. So I just like to just kind of end by reminding us of our interconnectedness and the importance and value of being kind of united and as one. So thinking about, that full sense of the word community. So it's not just a word, but it is really something that we all should kind of continue to live.
Absolutely.
I think he said it all. I think my only comment is respect your elders, people. Respect them,
Put some respect on their name.
Huh? All right, yeah.
Put some respect on their name, right?
That's right.
Respect, and I just really respect, the elders in my life. And so we want you to know that we're here. And Dr. Shepherd, you said it right. Identify people in your community that look like you who are doctors, right? If you can't do anything else when you're frightened about getting the flu shot or pneumonia, find out who the doctor is in your community that serves us, right? He may not be able to be he or she may not be able to be your physician, but can provide some information that would be useful. And we obviously want to connect people to mental health as well, because, although we do have, like Dr. Shepherd said, we do have Dr. Stark said, a resilient group of people is not anything to shy away from if you are experiencing anxiety and depression. That is something that we expect with the COVID pandemic and all the protesting. But, I have seen in the patients that I see, particularly the older people who have been stressed out, actually are recovering faster than some of the younger people are. So that's an indication that if you go get treatment, even if you're feeling down, because of the skill set that many of us already have, they actually are doing better and feeling more because of that. And so we had a bunch of things to discuss. Not sure if we were able to cover all of it, but I really thank Dr. Shepherd for having an opportunity to do this today. And maybe we need to do this again. And Dr. Starks, wonderful as ever. Thank you.
Yeah. Thank you both so much for the invitation. I truly appreciate it. And I guess just one reminder then is to tell people how to get access to care. So every state, every local, every county should have access to mental health services. So maybe if you type in the name of your county or type in the name of your state and type in mental health, many do have kind of 24-hour or some type of hotline to assist those who are struggling with anxiety or depression related to COVID. And so be sure to access those services and try to get connected to the care locally in your community. But yeah, thank you so much. This has been a great experience. Two of my favorite people here. So glad to be a part of your Friday.
All right. Thank you. Thank you.
Pick up an elder and take them to go vote if they haven't voted already. Help them. Some of them need access to get there. So if you know someone who can't get around but need to vote or can't figure out because it's so complicated to vote today, even if you're doing the mail-in ballots, help them. Help them.
Yeah.
Give them a call and give them some assistance. They need us. So
that's true. And I'm so glad you said that. In Maryland, actually, I didn't know this, that actually the early voting continues throughout the weekend. So I'm going this weekend. Actually ends Monday, and then we roll into Tuesday. Now, every state's not like that. That's just like that here in Maryland. I don't know what it's.
So your state, go to ivote.com or something like that. ivote.com, I believe is what it is, or your local state, and look and see what the rules are, because the rules are different for every state.
Yeah.
Yeah.
Well, wonderful. This has been an exciting show. It really has been. It's been informative. Again, where can you go and get a show like this and hear Black doctors talk at the level and expertise that they have? It is a rarity, and I am so proud to be a part of such a show. No, we just don't highlight Black doctors, but we love to highlight Black doctors. I'll just say it like that, because we have so much to share. We have so much to let our people know the insight that is available to them. And thank you again for this. Again, Hope Health Systems out in the DMV area. where I am Chief Medical Director. Dr. Kimberly Gordon Achape is Medical Director of Intensive Services, and we continue to expand our services. We have some exciting news that we'll continue to share with you as it is confirmed. But I will say this, our partial hospitalization program has started, is up and going. And so we've now added a different layer of services. So again, and we do have a geriatric psychiatry department.
Yes.
System. So when Dr. Stephen Starks is ready to leave Houston, yes, sir.
The person I'm calling, I'll pick up the phone.
Don't play with me, now, Dr. Gordon. No, I
have a contract in my hand in no time. Huh?
Yeah, look, recruiting. Now that's my thing. I'll play with recruiting. We be friends, but I'll put that recruiter hat. No, I get your get my hooks in you. No, yeah. But anyway. But we do have a geriatric department there at Hope Health Systems, and so we want to make sure that you even know that it's a part of Baltimore County in particular. All right, that is enough. We've gone over time. Dr. Gordon Achape, Dr. Starks, hang tight. We're going to end the broadcast. But again, 410-265-8737 is the number for Hope Health Systems. The website has been scrolling across the bottom of your screen all this time. Join us there. We'll do you some good if you're in need of direct care services. Until next week, we will be back. We will be peaceful. We will still be in our right minds next week, even after the results of the election has been made knowledge or made known, I should say. And I'm looking forward to next week. We've got some special surprises for you for the month of November. So please stay tuned. Thank you all. All right. And have a wonderful weekend.